We did the article on distant battlefields, survival odds rise sharply, and it was written by Alan Collison, and I'm Billy Painter, and this is Kendall McCann. First, I'll give you some background on the Afghanistan and Iraq war statistics. Right now, we have 55,000 U.S. soldiers in Afghanistan currently. There's 32,000 non-U.S. NATO forces, and right now the casualties are 1,043 for U.S. soldiers and 680 non-U.S. soldiers. In Iraq currently, we have 98,000 U.S. soldiers. All other nations have withdrawn their forces, and the casualties are 4,390 for U.S. soldiers and 316 for non-U.S. soldiers. That gives you a background of the magnitude of how significant and how people are dying actually every day over there. We have over 150,000 American soldiers in foreign countries right now fighting. The point of this article was how medical advancements are now arising because of the new techniques being used in this war and the high level of implementation that they can use it on throughout the injuries. Here's past wartime medical advancements. Every war that's been fought, there's been new medical advancements through the loss of life. And it's a strategic advantage to be able to help your soldiers re-heal. So throughout war, to get the advantage, different medical advancements have arose. During the Civil War, doctors learned the best way to amputate limbs and how to use different ways to numb the pain and tourniquet and to stop the blood. World War I, the development of the typhoid vaccine. World War II, mass use of penicillin was used. Korea and Vietnam, medical evacuation by helicopter. And if you look at all of those are still used today and were brought back into the mainstream society and used by hospitals. I'm sure you guys have seen helicopters fly over your house from hospitals. That started in Korea and Vietnam, and I'm sure you guys have all got a dose of penicillin or amoxicillin, and that was invented during World War II. So all have been transferred back to the U.S. for use for us. Recent medical advancements in this latest war include new ways to control bleeding. There's new quick clot combat gauze, which all troops are supplied with. This is better than they used to have a tear package and they'd pour on it, but it would cause burns. This is a lot better. It stops the bleeding better and is better for long-term use for the burn on around it. They've made sophisticated portable X-ray and MRI machines. MRI machine usually in a normal hospital, it takes up a whole room. It's pretty gigantic. In Kandahar, where this article actually takes place with Dr. York, the MRI machine has been made portable with the X-ray machine, so they can portable from base to base and where it's needed. New equipment to guide catheters through veins. New techniques recommended by physicians years ago are now being tested on a larger scale due to the severity of most injuries. A lot of these injuries are so extreme that you can't use what you would use in a normal hospital, and they don't have all the supplies that they use in a normal hospital. So they have to use new techniques that will work on the field and that can work out there. Right now, wounded soldiers are surviving at a greater rate than ever before in the history of war. Right now in Iraq, there's a 95% survival rate for those who live long enough to receive medical attention. So if a medic can get to you while you're still living, you have a 95% chance of surviving.
Okay, here's an example of a soldier that may have died before new technology was advanced there, but now he survived because of Dr. John York, who is an interventional radiologist, and a soldier specialist, Alwyn, was injured from an IED, which is like an explosive device, and shrapnel was grazed into his left vertebral arteries that went into his brain, and it was leaking into his lungs, which is it could cause him to die because of blockage. And Dr. York performed a breakthrough medical technique where he snaked a tube from an artery in his leg all the way up to the artery that was ballooning in his brain, and he blocked it from not the clot moving and the vein popping and him bleeding to death. Another example is when another soldier, an infantryman's leg, he had another IED exploded and he had a big wound in his leg, and there's a bunch of shrapnel in his thigh, and you can see the femur is splintered right there. And most doctors would have just amputated the soldier's leg because they would think the arteries couldn't be saved. So Dr. York injected a dye into the man's leg and used a nickel titanium filter to put in his veins, like around below his heart, so the clot wouldn't move from his leg to his heart and his lungs. And through the procedure, the soldier spared his leg and will be able to walk again, and he didn't have to have his leg amputated. So in conclusion, one of the positive things that comes out of war is the medical advancements that arise during the wartime, since they're so desperate for new techniques to save your lives, and they can be brought back to the U.S. and all other countries. And throughout the war in Iraq and Afghanistan, along with all the other war times, new techniques have been developed and have saved millions of soldiers and civilians' lives. And it was actually quoted in the article that medical textbooks are being rewritten as we speak due to these new medical advancements, and that a Sergeant Anthony Reich, who's equivalent to a paramedic in the U.S. Air Force, said that.
That's it. Any questions?
I have one. Though soldier survival rates have increased, but medics have to deal with an increase in complications among patients. How could medics face this problem?
How could medics face the problem?
Face the problem, yeah, because like the survival rates have increased, but there's an increase in complications as well.
Well, that's kind of what the article is about. They're trying new techniques and inventing new techniques that weren't allowed to be tried before. I mean, it's not usual you see the severity of these injuries on a mass scale when we're not in war. So you can't try new techniques that people are imagining because you can't have a large scale, and you don't want to try a new technique on someone in a hospital. So you're getting this mass scale of really severe injuries that you're allowed to try the new techniques that were, before this war, not able to be tested. So both are rising, the severity of the injuries and the procedure in which they're correcting it with. So it's really advancing our medical knowledge.
There's also a lot of techniques that they're able to use over there that people here would consider unorthodox. Like they give soldiers like dose of ketamine, so they like aren't feeling any pain at all, which they would not use here for people with injuries.
What future medical advancements, like further, could the U.S. military make?
Right now, they're focusing on not getting the soldiers injured. They're working on better armor. Right now, in Iraq and Afghanistan, most of our troops are getting injured by the IEDs, mostly in their Humvees. They're driving over them and they're getting blown up either remotely or via like vibrations. So right now, they're really focusing on the medical doctors are focusing on their portion of new techniques and stuff, but the Army itself is really looking at trying not to get the soldier injured. Obviously, it would be better in the first place to not get him injured than to get him injured and help him survive. So